Welcome to Hopeful Hands. I am your host, Dr. Tara, and today we're going to be talking about hormone imbalance signs that you're ignoring or have been told are normal when they are not, and what you can do about that. I often find that women have been told everything's normal, or you'll hear me talk a lot about how your physical symptoms are being blamed on all these external things, your kids, your work, your committees, your everything else. And no matter what you do, you still feel exhausted or anxious or just not like yourself. You're not imagining things. You're not crazy. Hormone imbalances show up and they can be sneaky and they can happen long before actual concerning things show up in your blood work or it becomes a disease. Many things like mood changes, poor sleep, bloating, thinning hair, all of these things are early signs and they are just dismissed by the medical community so often. It's actually your body's way of waving a red flag and saying, help me, I'm giving you signals. Oftentimes, this might look like you're tired, but sleep isn't fixing it. Your weight will not budge, no matter what. You are eating clean, you are going to the gym for hours, you're working out harder than everyone that you know around you, and it's not budging, and you're not feeling good. Out of nowhere, you're feeling anxious. Your stamina and your oomph is low. Your periods are unpredictable or painful and very symptomatic, or you're totally missing your period. And perhaps you're getting, here's your birth control, and that's your only option. These things are just not okay. So today I'm going to help you decode those signals and give you some tools to start feeling like yourself again, or action steps that you can do after listening today. I talk about this often. Traditional labs just focus on broad ranges. They are designed to detect diseases, not dysfunction and precursors before the disease happens. So you will fall with the normal ranges and still have all of these symptoms going on, exhausted, anxious, all of the things, like a stranger in your own body, and no one is doing anything for you. And it's frustrating, and you lose faith in the healthcare system, to be blunt, but you're exhausted from trying to figure out what is going on with your body, and you keep going in and you keep going in, and no one is giving you any help with this. And so that's why we believe that you need to take a deeper look at your hormones and take some initiative and try one more time. That many women will experience these imbalances and we don't even connect them as being extreme. If you're not in your head and feeling like this is you, you're in the right place. I'm going to break these down for you. I have helped thousands of women get to the root cause of their symptoms, especially when conventional care has not given them answers. So if you're ready to start feeling like yourself, stick around. I'm going to share some tips and tricks that you can do. Let's start by looking at progesterone. Totally ignored hormone, often ignored completely, but perhaps until you are 40 or older, then maybe someone will start talking about this with you. Or if you're pregnant and you've had multiple miscarriages, not just one, that's when we believe it should be looked at. We believe it should be looked at in preconception, but let alone one, providers are not taking this serious. So some symptoms that your progesterone might need help. The first one that I talk about is PMDD, premenstrual dysphoric disorder, which gets missed all the time too. But days or weeks before your period starts, are you having symptoms? Is there mood shift swings of any nature going on? Breast tenderness, joint pain, puffiness, swelling, kind of like allergic like reactions going on too? Are you bruising? Do you have skin changes? Poor sleep? And then think about ovulation time too, back up a little bit further, but are you having some of these symptoms around or right after ovulation? Do you have a short luteal phase? Do you have spotting before your period? Are your cycles getting shorter and shorter? Are you someone who historically or currently is having miscarriages? And so oftentimes the cause of a lot of sex hormones being imbalanced is stress. And when I say stress, I want you to kind of shift how you think of that. I want you to think of the word stress as cortisol imbalance. Because when your cortisol is off, it suppresses, or when it's higher, it suppresses sex hormones. We don't need sex hormones when there's a bear chasing us in the woods. We need to divert all of that energy to other organs in our body to survive. Under eating, That will cause it too if we're not getting enough nutrients and we're skipping meals and we're going long periods of time without eating. If you're not ovulating, that can be a sign too of progesterone issues going on. Some things that you can do to kind of help with this naturally is zinc, vitamin Bs, vitamin C, all of the things to manage your stress. I'm air quoting that, to manage your cortisol levels. It is something I'm currently working on personally. So come along that journey with me. I'm right beside you. But some women will use things like Vitex. There's a lot of herbals and there's a lot of proprietal blends that are out there now too to really help with this, the ashwagandhas. And then just consider bioidentical progesterone therapy. So that's something I'm going to be bringing in personally as we speak to my luteal phase. We do that a lot for our fertility patients, our perimenopause, our patients as well. Our menopause women just get it. But we will cycle our progesterone. And there's a lot of great things you can do that are safer with bioidentical progesterone as well. The next one we need to talk about is estrogen. It's very common in women, again, who have PMDD, endometriosis, adenomyosis is higher or bouncing around estrogen levels. We like to use a Dutch test to really look at what pathways you're kind of moving that estrogen down. But bloating, breast tenderness, heavy crampy periods, mood swings, irritability, things like that really can be caused by poor estrogen clearance. What's your GI system doing? Because that's how you're moving it through. So if you're constipated or have all these bowel dysregulation, dysfunction going on, chances are your estrogen is going to be impacted by that too. We love using flax and broccoli sprouts, like going and actually getting broccoli sprouts and eating them, or sulforaphane encapsulation, magnesium, and then looking at your external stuff when it comes to plastic, fragrances, like what is in your environment daily that you're interacting with from an environmental standpoint, because it is likely impacting the estrogen. And then from the other side of medicine too, supporting liver detox. What's your liver like? Love acupuncture, by the way, for all of this. I should throw that in there. Acupuncture is a great way to hone in, and working with someone who specializes in herbs too can really help all of those sex hormones. Thyroid. Go grab your labs. Likely, you've probably only had a TSH checked, and they're like, you're fine. And the range is huge. Again, understanding we need more than just your TSH checked, but fatigue, cold sensitivity, weight gain, constipation, dry skin, hair loss, hair thinning, depression, mood fluctuations, inability to lose weight. Maybe you're even on a GLP. Maybe you're on the GLP and you're not losing weight anymore. You're stuck. A hard time getting out of bed in the morning, hitting snooze a lot. We really got to look at your thyroid and a full thyroid panel. Often this is caused by autoimmune, Hashimoto's. Thyroid issues are just, again, super overlooked, but also nutritional deficiencies. Stress, aka cortisol, can really mess the thyroid up too. So TSH, free T3, free T4, what's your antibodies doing? Selenium, iodine, and possibly bringing in desiccated thyroid. That is our favorite thing that we love in our practice. And there is supplements that you can use to support your thyroid too. Often they have selenium in them as well. So getting an outside workup or second set of eyes, if you're worried about your thyroid, that is one thing that's worth growing your team on, is your thyroid. And then cortisol, or AKA our stress hormone, it is common in high functioning women. Okay. Like, we are thriving over here. This is me. We're not burnt out. We prefer to thrive in this area, but internally, I'll tell you what, I just got my labs drawn this morning at time of recording this lab or this podcast. So I will share that with you on my social more than likely, but my cortisol is just jacked through the roof. I know that. I'm tired and wired. If you are a tired and wired person with poor sleep, I'm exhausted, but I am wide awake at night and then have a very hard time getting up in the morning. Anxiety, we're out of nowhere, just fluctuations in your anxiety. Belly fat, if you tend to hold a lot of belly fat, cravings, a lot of that can be related to the cortisol. Chronic stress, over exercising, poor sleep in general are the ways that will drive that up faster than anything. So adaptogens like ashwagandhas, rhodiola, stabilizing your blood sugars, making sure you're getting enough protein, eating every 3 to 4 hours, magnesium glycinate. And then my favorite, but boundaries. I am truly trying to set boundaries. Ask for help, getting things off your plate, really working on your nervous system. And I'm still working on all of that. There's about 800 ways you'll hear of working on this, but things I'm incorporating is red light therapy, When we move, I'm going to be getting a sauna. If you're into all of that, there's of course a sauna cold plunge, but just regulating your nervous system. I'm going to go back to acupuncture. Again, saying no, setting boundaries is just, it is so important. And for so long, I personally have not been doing that. And I really encourage you to check your surroundings and see how you can kind of do that and not feel like you have to be the superhero anymore in life. Working with coaches, I've had coachings, I have apps on my phone where I'm doing different tips and things and tools to regulate my nervous system, essentially, is what I'm working on. But the next one is insulin resistance. Again, so overlooked and dismissed. I don't care what your weight or physical appearance is, you can have insulin issues and resistance and dysregulation of your insulin. And so again, it is often that individual who is working out and still not feeling good or gaining weight, cravings, sugar cravings, fatigues after eating, skin tags. PCOS is its best friend. If we're not sleeping or we're waking up often in the middle of the night, our insulin's often dysregulated with that. So again, working to grow your team to someone who can help you put together a plan for you, or just adding more protein and fiber into your meal, taking bites of your fiber first. Apple cider vinegar is a favorite of ours as well. Walking or doing squats, even just stand up and do some squats after you eat. There's some supplements like berberine and other things like that too that can really help you with that. So what I want you to do starting today is kind of just start tracking your symptoms. Use the free apps, use your notepad in your phone, use paper, whatever you need to do. And then your provider can see, are they around the time of your ovulation? Is it in your luteal phase? Is it before your cycles? We can help you figure that out if you just put it into a calendar into the notes section. Ask for the right labs, or going and getting them on your own. Going to a walk-in lab where you can just get these on your own. Getting the home kits where you can just get these things on your own, or asking your provider to simply order them for you. Support your body with the right foods, the protein, the healthy fats, broccoli sprouts. That's like number one thing like we talk about is adding broccoli sprouts and flax and things like that too to your smoothies or your sandwiches or your salads. Managing your stress and improve your sleep. So managing your stress, I'm not going to give you tips on that because quite frankly, I'm still trying to figure it out myself, but only you get to determine how that happens. We know of all the tools and all the things that we're supposed to do, and it's in your time and in your style and method. If someone told me to journal, I would laugh at them. That's not something I'm ever going to do. And for the next person, it works great. So just finding what works for you and using those tools appropriately and doing one tool at a time. Don't feel like you have to do them all at one time. Consider supplements. We don't care that supplements are not FDA approved. Duh. If a provider is still saying that to you in 2025, we have issues. There is safe supplements and there is low, bad quality supplements. So working with someone who actually is trained in supplements to help you find the right one, the right brand, and getting you on the right one that your body needs so that you don't have a kitchen cupboard full of supplements that you don't need. Magnesium, your B6s, your Vitex, your adaptogens, and making room for those too based on what your needs are. And then again, working with a provider who listens to you, who understands the whole picture, and can just look at everything and look at you as a whole person. So if this video felt like it described you, leave a comment. Let's start sharing about this more. Share your biggest symptom of concern if you're watching on YouTube. I want to hear from you. And if you are looking to start working with somebody who is trained in this, I am here with my coaching program for you. I have tons of freebies over on drtaraharding.com. Hormone imbalance does not mean you are broken. It means your body is trying to tell you something. And now you have some tools and tips to start moving forward with that and start putting yourself and your health first. So I'll see you in the next video. I'll see you in the next podcast. Thank you so much for tuning in this week.